Dr.
We don't.
Sauerberg, you said that the healthcare system is heading to implosion. I wonder if we might hear from some of the other doctors as far as their experiences, what they're hearing. You know, what frustration and problems do you see within the current system?
And before they get going, we have time for 3 more questions.
I'm from Dr. Sauerberg's area, the suburbs of Chicago, and one of the big decisions that we had to make this year is whether or not to continue with Medicare. More and more physicians in our area are beginning to opt out of Medicare just because of the financial constraints and the difficulties. And in our community, probably 15–20% of our patients are Medicare. Talk about overwhelming the system. You get those patients not being able to access the physicians that they want. It's going to put a big strain in our area. And you mentioned before about how we have a free system right now. Everything is hinged on Medicare. All our contracts are a percentage of Medicare right now. So whatever the government puts out there as the fees for that particular year, the insurance companies go 10% above, 15% above, 5% below. So in essence, we have a fixed price system as it is now. You know, every year, towards the end of the year, Medicare, to reconcile their budget, decides how they're going to either reimburse physicians a little bit more or cut back. This year they decided to put a moratorium for, I believe, 6 months, and they have given us a 0.8% raise in our fees this year, which, as you know, medicine inflation runs rampant, 4 to 5% a year. So every year there's a decision that needs to be made for dollars and cents whether to continue with Medicare. And we have a 6-month moratorium, but again, I have to stress that more and more I see physicians opting out of Medicare.
Dr. Cahill, could you speak from a Springfield perspective as far as with the access to healthcare we have here locally? Are we in a period of crisis? Are these sorts of drastic changes necessary?
Actually, I've only been in Springfield for 2 years. I'm from downstate Illinois, from Belleville. And the reason I came to Springfield was that we had a big change in our medical practice in Belleville. We had a situation where we lost 30% of our local doctors. So look around this room, 3 out of 10 people were gone. Now, I didn't think I was going to be one of them, but I turned out to be one of them. Now I come to a different place, a different town, Springfield, which doesn't have quite the loom of medical malpractice crisis that we had then. Of course, there has been a tort reform bill since that time in the last 3 years, and that is being tested at the highest court level, and we'll see if it passes. If it doesn't pass and tort reform becomes a dead subject, it's not alive anymore, we may find that even in this area, medical malpractice may become a big issue for the doctors. And if you look around, you see a lot of gray-haired doctors. You know, it is known that the doctors in this country are getting older. They are, no offense meant, but the doctors are getting older. There's not enough doctors in this country, and if it does become a crisis over the next 4 or 5 years, and the doctors are really feeling it in their pocketbook, unfortunately, a lot of these people who are close to retirement may just do what a lot of other people do when they get close to retirement. They don't like their job, they may just get out. And if that happens, we could see a loss of a lot of doctors across our country, and that would have a very detrimental effect upon our health care. I know in Belleville, I still have relatives in Belleville, and access to medical care is a problem. People are having trouble getting to see an MD. A lot of patient extenders, a lot of PAs and nurse clinicians, which we have a lot of here in Springfield too, and they do a very good job. But the difference is, it's just a lot harder to see the old MD down there. And so there is a difference, and we really haven't felt it in this area, but you know, we didn't think we were going to feel it down there either, and we sure did feel it, and it caused a lot of changes in the whole way of medicine.
Dr. Sauerberg, one other issue. What do you make of Bill Foster's win over the weekend in the special election? Is the state turning more blue? Last time you were here, you said Dick Durbin's too liberal, but it appears that the state is becoming even more Democratic.
Well, I think in a special election, it's such a unique environment. You hate to comment on it. You know, the voter turnouts probably were very low. I don't know what it means. I don't know if it's significant. I think postulating about that in terms of any effect it has on the general election, I think is questionable at all, and I don't want to spend our time today on that. We have another doctor with us, Dr. Phil Johnson from Litchfield, who just got done delivering a baby, which is a very brave thing to do that I quit doing several years ago purely for financial reasons because I couldn't afford to pay the insurance anymore after delivering 500 babies, and I actually delivered somebody I delivered one day, which was quite fascinating, but unfortunately I had to give it up. Malpractice insurance premiums would not allow me to continue. Let me comment very briefly. These gentlemen here, Dr. Cahill is 100% correct. There is some gray hair, except for the young Dr. Kinsinger. If we don't work, and then for 10 or 15 more years, there will be a doctor shortage. I guarantee it. These are the gentlemen who not only work, these are some of the most productive physicians in your state. The guys over 50 are sometimes the hardest workers you have. And if they decide enough is enough, it's going to be devastating. I guarantee it.
And now, Dr. Kinsinger is from Washington, the Peoria area. He's a family doctor, and Dr. Johnson was a family doctor from Litchfield. You guys like any background on those areas? No? Well then, I think we're going to have to wrap this up. Thank you very much. Thanks for coming on.
Thank you all.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois. If you have any comments or questions on our programming, please email us at illinoischannel@aol.com. Or if you have any questions about the Illinois Channel, please visit our website at www.illinoischannel.org.